I'm here to talk about uncontrolled bleeding from cuts which happen probably at home or anywhere outside the hospital premises. A few things you can do, do's and don'ts about cuts. Point number one, do not touch blood of another person you do not know with bare hands, especially if you have cuts on your hands, because it's high chances of contamination with HIV, HPSAG, HCV, etc. So personal protective equipment to don on is very important before you stop bleeding of somebody else. Point number two you need to remember is apply pressure bandage over the cut area and to stop bleeding. In case the bandage is soaked, please apply another bandage on top of it, but do not remove the applied bandage to see and check repeatedly if the bleeding has stopped or not, because that can actually dislodge the clot and worsen the bleeding. Keep on applying pressure bandages and keep pressure till the bleeding stops and rush the victim to the hospital as soon as possible. Number three, try to keep the cut area above the heart level so that the heart cannot pump against pressure against gravity, so that will stop bleeding to some extent. Point number four, if there is a limb from where the cut has happened, then probably you can immobilize it by using a small splint so that the hand or the leg is not mobile. That will prevent bleeding to some extent. It is very, very important that just not external bleeding, internal bleeding also can happen for patients who fall from height. In case you have a suspicion that somebody is having an internal bleeding, the first thing you need to do is call emergency, call ambulance services and rush the patient to the hospital as soon as possible. In the meantime, make sure that if there is an internal bleeding suspected, keep the limbs, the lower legs elevated by about 6 to 12 inches above the ground so that the blood is pulled back to the heart and shock is prevented. For these things, these are the basic things you can do to prevent bleeding in a pre-hospital setting.